Thanks a lot for inviting me again to give a talk on some of the work that I've been doing. So I'd given a talk in April about using synthetic controls to analyze the spread of COVID. And this is a follow-up to that talk. So what I'm going to do today is, I had spoken about synthetic controls the last time. I'll give a very quick overview of what synthetic controls is. Then I'll talk about how we can analyze COVID-19 data using synthetic controls. And then I'll talk about post-Memorial counterfactual analysis of the COVID spread. As we know that after Memorial Day, things have really gone haywire in the US, and we're trying to figure out what has been happening, why it's been happening. So let me first start with a very, very quick overview of synthetic controls. So synthetic controls, it's an empirical methodology for causal inference using observational data. And the canonical application where it was used was to understand the effect of this thing called the Prop 99, which is a tax on cigarettes that California imposed in 1988, and to analyze what is the impact of that policy on cigarette sales or per capita cigarette smoking. And 10 years later, they found out that cigarette sales had gone down. But the question was it because of Prop 99, or did society move on from smoking because national averages fell as well? So there's this economist at MIT, Alberto Abadi, he came up with this idea of synthetic controls. And the basic idea is that you take a geographical region and you can approximate that geographical region as a linear combination of other geographical regions. And when I say linear combinations, you take linear combinations of the metric that you're interested in. So for instance, it could be per capita smoking or number of cases with COVID or number of deaths or whatever. So what you do is you create a synthetic version of your region of interest. And then what you can do is once you have applied some intervention, like in this case, Prop 99, post that intervention, you compare the synthetic version with the actual version. If you see a difference, then you can say, okay, the intervention did have an impact. So for instance, so now if you want to analyze the impact of Prop 99 on California, well, you create a synthetic version of California and compare it with the actual version. So here I'm showing you results for this Prop 99. It was implemented in 1988. So that's the vertical line. On the left, the solid line are the actual per capita cigarette sales. And on the left of the vertical line, the dashed line is the model that you build. So you, on the actual sales data, you train a model and you use data from other states to create a model. And to the right of this vertical line, you observe the model. Now the model does not use actual data from California. It's using data from other states. And from this, you can clearly see from the left chart, the synthetic control view, that Prop 99 did have an impact. Smoking fell sharper in actual California versus synthetic California. Now, in a conventional A/B testing view, where you compare California to the rest of the US, which is the right graph, this thing doesn't come out that clearly. So synthetic controls is a way to really zero in on the impact of a particular policy or intervention or things like that. And for COVID case, we can analyze the impact of lockdowns or masks, things of that nature. Now you might say that what we did here could simply be a case of overfitting, right? You use data from the other 49 states and you can simply fit anything that you want to the left of the curve. And how do we know that it has any predictive power on what happens to the right of the vertical line? So the answer to that is you build placebo models where you take states which did not have a Prop 99, let's say Colorado, and you build a model for Colorado using the other 48 states. You don't use California. And then you compare synthetic Colorado to actual Colorado in this predictive period to see if it has actual predictive power. Because Colorado did not have Prop 99, the synthetic Colorado should match actual Colorado. And that's exactly what we see. We did a bunch of placebos, and you can see that, this technique has predictive power. I'm not going to go into the theory of it, why it has predictive power. It has something to do with low rank matrices or tensors, but this thing actually works. So we can use it to do predictions. So how do we do COVID analysis? Well, one problem with COVID analysis is the time series that we look at. they are not aligned in terms of absolute dates. For the smoking case, everything was, the absolute date, the time series made sense. But since the virus reached different places at different times, whether it's Western Europe or Wuhan or the Northeast or California, the time series are not aligned. So one idea that people have been using is you align these time series based on the thresholds of cases or deaths. You pick a threshold that, if a place reaches 5 deaths or 10 cases or whatever, then let that be equal to 0 and align the time axis or timeline according to that. One problem with that approach is that lockdowns are actually an intervention. They change your R naught. And so the behavior changes after lockdowns. So in fact, a better idea to do COVID analysis is not to use this absolute threshold, but instead use lockdown dates. So that's what I started doing. I got these lockdown dates from IHME. We all have heard of IHME. So they have created this data, and I started working with them. They sent me this data of when different places impose different kinds of lockdowns, whether schools were closed or non-essential services were closed at a county level. I also augmented this data with Google's public mobility data set. So Google has this public mobility data set where they show how mobility has changed over time. And when it suddenly drops, then, like one of the earlier talks that we heard today, people start doing the lockdowns independent of any mandate. So for instance, Sweden did not have any publicly announced lockdowns, but you could see that mobility fell there second week of March, like almost anywhere else in the world. So what we did was, you pick the last announced measure, the strictest lockdown date. You assume that your R naught is constant up until when things start opening up, and do the analysis based on that. So once you align data based on these lockdown dates, your clear patterns emerge. So here I'm showing a moving average of daily deaths for New York and some Western European countries. On the left is days since lockdown. On the right is the chronological date. And you can see from the left curve that it's, as soon as you do it based on lockdowns, they are essentially the same curve. So that it's a much more informative way or a better way to analyze if you do it based on lockdown dates. So in my, the last talk that I had given, it was April 15th, I had built a model for New York. So now I'll show you the results of the model. So here's predicting New York cases using Western European nations as the donor pool. So the donor pool is the one that you use to create a synthetic model. So, after only 5 days of training, I created this model and I could predict what was going to happen 120 days in advance. Because Western Europe is ahead of us, you could keep on predicting ahead of what was going to happen in New York. And you see the predictions match almost perfectly. And on the left, I'm showing what are the weights that came out in building this model, which are the sort of Western European countries that are most predictive of what's happening in New York. Now, if I had used all Asian countries like, South Korea, Japan, Wuhan, the weights of them dropped out. They were very low. So you couldn't really, they were not part of the model. But in this case, it has a high predictive power. Here again, using predicting deaths, you can see that's very, very accurate. 5 days of training, and you can predict all the way up to last week what is happening in New York. What you can also do based on this model is a counterfactual analysis. What if the lockdown in New York had been put in place earlier? So I'll show you a quick animation. This shows what happens if the lockdown was moved 0 to 19 days ahead of when it was actually put in place in New York. And you can see that, the predicted deaths goes down dramatically. Now, this was also confirmed by another study from Colombia, it attracted quite a bit of attention, including from the president. But, epidemiological models also sort of confirmed what we had predicted using synthetic controls. Now, one thing you might ask, looking at the shape of these curves and the fact that our model was confirmed by epidemiological models later is, aren't epidemiological models enough? Why do we need synthetic controls? Well, then the question arises, what's going on here? This is not predicted by a classical epidemiological model. US is behaving very, very differently from the rest of the world, which are following, the classical sort of SIER model with some variation. Or if you go down to state level and you look at the cases and deaths. So what we need is a data-driven, non-parametric way of looking at things. So we'll move away from the SIER, nice differential equation fluid models. I've also done work on that, but let's look at a synthetic control way of analyzing behavior in the US. So now the US itself is a story of 4 behaviors. If you look at the Northeast versus West, South, Midwest, the behavior is fairly different. These are the cases, moving average of cases per million for the 4 regions in the US, and you can see a clear difference between the South and, let's say, the Northeast. Now, a lot of this is sort of heuristics. We hear that Northeast has performed better versus the South and the West. What we decided to do is we also took a data-driven approach of let's try to identify clusters, not based on this, what we have been reading that Northeast is doing better and, South is doing worse. What we did was we looked at the mobility patterns of every state in the US post-lockdown and created clusters based on how the mobility patterns changed. So we took, the data from Google, and the specific mobility pattern that we looked at was retail and recreation. So retail and recreation, and we looked at, 6 weeks from lockdown, how they changed. And our analysis, completely data-driven, came up with 4 different clusters where mobility had, in some cases had gone back, and especially in cluster 1, you see, had gone back to almost normal, whereas cluster 3 and cluster 0, mobility was fairly low, even 6 weeks after lockdown. So these places were more careful at opening up. And we can see what is the impact of that. So when you translate these clusters into a map and what's going on, you see this map. This shows how mobility changed in these different regions and what the cases look like. So now this actually gives a better sort of view of what actually was happening. So here, Northeast, in my early analysis, I included Pennsylvania in my analysis, and that caused the Northeast curve to grow slightly higher than what we see here, because Pennsylvania actually has been behaving differently from other places, mainly in terms of mobility and opening up. And I'll present a post-memory list synthetic intervention analysis. So what we do here is...
Vishal, you have 2 minutes, okay?
Yeah, so I'm just going to present the results. So we did, we use the cluster 3, which I showed as the donor pool, and we built synthetic models for different regions and picking up similar counties and showed how it looks. So we did Massachusetts with this cluster 3, which was a good cluster. And you see there's a good agreement between aggregate cases predicted by the model and what actually happens in Massachusetts. These are all the counties in Massachusetts. The red is the actual, the blue is the prediction. This agreement persists when you look at daily averages. This is aggregate, this is daily average. It's noisier, but actually there is still very good agreement between the model and what is actually happening. Now we look at Georgia with cluster 3 donor pool, and you see there's a dramatic difference. What the model predicted, what should have happened, cases have just shot up. Look at Florida, same story, dramatic difference. Texas, again, dramatic difference. Now I picked Michigan. Michigan was one place identified by analysis in a data-driven manner. It's not in the Northeast, it's in the Midwest, but the mobility pattern was similar. And when you do Michigan using this cluster 3 donor pool, things actually match. Michigan, whatever has happened there, they are behaving well. So the question is, why is this happening? Is it because of masks? We all saw the protests, everyone was wearing masks, no surge in cases. Texas, no masks, big spike in cases. Somebody has done this analysis where they show that where masks are mandated, cases have not risen as much. Another thing is AC usage. Is it because of AC? Hotter places have had a higher rise in cases. It's because people are indoors and ACs are, circulating droplets. Another issue is it herd immunity? People said the Northeast got hit early, and so a lot of people had became infected, and that slows the virus spread. So what we did in this analysis, what I'll show you, is we picked counties in other regions compared to cluster 3, where they had a similar level of infection on Memorial Day, and showed the performance. So on the left is a county in Louisiana, and we had a comparable county in Middlesex, Connecticut, and you can see Louisiana cases are shooting up. In Connecticut, model is matching reality. This is a 6,200 cases. This is Hall, Georgia versus Wayne, Michigan. Again, in Georgia, cases are shooting up, away from what is predicted by the cluster 3 model. In Wayne, Michigan, it's they're down and they're staying down. Broward County, same story, compared to Genesee, New York. Genesee, New York, things are under control. The curve is under control. It's been flattened and stayed flat. In Broward County, it's just rising. San Bernardino, California. I'm actually working with the state of California COVID response task force, trying to understand what is causing all these differences, whether it's mask mandates, whether it's mobility, AC usage. And there's some interesting data that we have uncovered. So now I'm going to stop here, and I can take questions.
Thank you, Vishal. Do we have any questions from the attendees? If so, please raise your hand and we can allow you to talk. And if not, I'll lead off with a question, and that is, how far out in time is your predictive model accurate or a value?
So as I said, if you're trying to do prediction, it depends on when the virus hit. So since the virus hit East Asian countries a lot earlier than New York, we can use data from there, which acts as future for us. So, but the interesting thing was, in the case of New York, East Asian countries were not a good model, but Western Europe was a good model. And completely independently, we also found out that the strain of virus, which was found in New York, came from Western Europe, and it did not come from Asia. So how far ahead we can model, predict? Well, it depends on what the donor pool looks like. Where is the donor pool in its evolution? So there are two things that you can do with this analysis. You can do prediction, and you can do this counterfactual analysis, which I'm showing on the screen right now. So on the screen right now is a counterfactual analysis. The blue is where things should have been. Red is where things are.
And we have a question from Rodney. Rodney, you can talk.
Yes, thanks. I love your analysis. It's amazing. So when I want to probe a little bit more on what you just said about using European data compared to using Asian data. So are there any states or any places in the world that are more matching the Asian data than you might have expected?
So what had initially, when things had just broken out, the state of Washington was better modeled by East Asian countries, but that's no longer true. And over the past couple of months, actually, I've been focusing mainly on analyzing county level data. And, now the Northeast is better modeled by East Asian countries, but not the rest of the US. And more specifically, the cluster 3 that I identified based on mobility patterns. I think whatever has happened in these places, I'm not sure whether it's people are not moving that much, or people are wearing more masks. The mask compliance is a lot higher. I go to Central Park, 90% of people are wearing masks. And indoor dining has not been allowed. So, the recirculation of droplets using ACs is not happening. Whatever they might be, we are now behaving much more like the rest of the world, whether it's Europe or East Asia. But New York and Northeast Massachusetts, Connecticut, New Jersey, we are now behaving a lot more like the rest of the world compared to the rest of the US. The rest of the US is in a world of its own.
Okay, we have one more question from Stuart Firestein. Stuart, you should be able to talk now.
Great, thanks. how granular can the data get before it becomes too noisy to be useful? That is, right now you're at counties. Can you get to neighborhoods or things of that nature, suburban versus urban?
Yeah, so for the state of California, we're trying to do analysis based on census tract level data, because their counties are huge.
Mm-hmm.
You go from one end to the other end of county, and the differences are quite big. So we are working with census tract level data, and the key really is, census tract level data should work. Neighborhood should work. What the key is, you should have enough donor pool elements which are roughly similar, and then we'll go through a denoising step to take care of if the data is noisy. So there is some sort of pre-processing which does denoising, but neighborhood level data, yeah, we can work with that.
Thank you.